That's right. So for those for whom it is not working, they can choose Medicare. For the culinary workers in Nevada who I listen to, who negotiated for those plans,
for people,
they're able to keep them.
Why are you defending private insurance?
Say they like their private health insurance, by the way. It should
He'd
be
been to a
noted.
doctor once in his life, and on that visit, he was told he had diabetes, he was told he had glaucoma, and he was told untreated because he doesn't have health care, he'll be dead before the age of 40. So getting to guaranteed, high-quality, universal health care as quickly and surely as possible has to be our goal. The ability to afford your prescriptions and go to a primary care provider. The ability to see a mental health care provider. In Texas, the single largest provider of mental health care services is the county jail system today. And healthcare also has to mean that every woman can make her own decisions about her own body and has access to the care that makes that possible. Our plan says that if you're uninsured, we enroll you in Medicare. If you're insufficiently insured, you can't afford your premiums, we enroll you in Medicare. But if you're a member of a union that negotiated for a health care plan that you like because it works for you and your family, you're able to keep it. We preserve choice by making sure that everybody has health care.
Time is up, Congressman, but I do want to ask a follow-up on this one. Just to be very clear, I'll give you 10 seconds. Would you replace private insurance?
No, I think that choice is fundamental to our ability to get everybody cared for.
Private insurance is not working for tens of millions of Americans. When you talk about the co-pays, the deductibles, the premiums, the out-of-pocket expenses, it's not working.
That's right. So for those for whom it is not working, they can choose Medicare. For the culinary workers in Nevada who I listen to, who negotiated for those plans,
for people,
they're able to keep them.
Why are you defending private insurance?
Say they like their private health insurance, by the way. It should be noted that 100 million Americans. I mean, I think we should be the party that keeps what's working and fixes what's broken. I mean, doesn't that make sense? I mean, we should give everyone in this country health care as a basic human right for free. Full stop. But we should also give them the option to buy private insurance. Why do we have to stand for taking away something from people? And also, it's bad policy. If you go to every hospital in this country and you ask them one question, which is, how would it have been for you last year if every one of your bills were paid at the Medicare rate? Every single hospital administrator said they would close. And the Medicare for All bill requires payments to stay at current Medicare rates. So to some extent, we're basically supporting a bill that will have every hospital close. I mean, my dad was a union electrician. Right? I actually grew up in a working class family. He loved the health care that the IBEW gave him. And I just always think about my dad and anything I would do from a policy perspective. He'd look at me and he'd say, good job, John, for getting health care for every American. But why are you taking my health care away?
I've let this play out a little bit because I'm fascinated to hear the daylight between you. Congresswoman Gabbard, weigh in here.
I think we're talking about this in the